All right, let's get started. So, good evening. My name is Brittany Shanahan, and I am the Medicare for All organizer at Public Citizen. I want to thank you all for joining our special webinar to kick off our organizing work to build a movement for Medicare for All in 2025. And while it's my usual habit to thank attendees for coming to events like this, I think it's really important tonight to highlight the importance of your decision to join us. We all know that the healthcare system in the United States is broken from a patient's perspective. We know there's high levels of medical debt, delays and denials of necessary care, and unaffordable medications. All of these things contribute to the US's reputation as the sickest country in the developed world. But from a corporate perspective, the US healthcare system does work, right? Exactly as it was designed to work, to generate massive profits for the insurance industry, big pharma, and nefarious forces like private equity investors. And so, in case it wasn't clear already, let me state why we're here tonight. We're here because we know that in order to fight back against the Trump administration on healthcare, we need to be vocal about what the alternative is. And that alternative is Medicare for All. So let me go over the agenda for tonight briefly. I'm going to kick things off with just a quick introduction to the Medicare for All bills. And then Representative Jayapal just lost her father 2 days ago and has gone to India to celebrate his life with her family. So we will be resharing a clip from one of her private speeches. Prior speeches. And we're also going to hear from the delightful Representative Debbie Dingle, the co-author of the Medicare for All Act, about why this policy is at the center of her reasons for serving in Congress. After that, Public Citizen's co-president Robert Weissman will offer some words on Public Citizen's longstanding commitment to single payer and why our organization chose to build one of our long-term core campaigns around Medicare for All. After that, we'll shift into some discussion about what our organizing work looks like and hear more about the 134 municipal resolutions that we've passed around the country in support of Medicare for All, thanks to the tireless work of grassroots activists like you all. We'll hear from Scott Gruber of Metro DC DSA about what Medicare for All organizing looks like on the ground in Northern Virginia. In tonight's webinar format, unfortunately, only panelists can speak, but this is still an interactive event. So please put your name, pronouns, and where you are from in the chat, as well as what motivates you to support Medicare for All. And if for some reason the chat isn't working, please send a message to one of us and we will fix it because it is looking a little bit quiet. We'll fix it if it's broken. We will also have an interactive portion at the end to help you think about some ways that you can be a part of this movement. So just to set the stage for where we are right now, it's the first week of Trump's second presidency. This is already inadequate healthcare system is under attack in ways that directly impact the ability of people to get care when they need it. Removing the restrictions that barred ICE agents from entering hospitals is an assault of the most basic principles of providing care. Parents of trans and immigrant kids are seriously wondering whether it's even safe to bring their child to a physician's office at all. We're now in the thick of at least 4 years of nonstop fights when it comes to healthcare, and that's already affecting how we hold space together as activists. We know it's important that when we organize events like this, to be able to look around the room to see who's included on a speaker's panel. But right now, a lot of healthcare activists, especially when it comes to advocacy care for minorities, are already out there right now fighting against the administration on these issues. Not everyone who wants or planned to be here is able to join us tonight, and some had to cancel at the last minute in order to show up for these other fights. So we know that they're with us in spirit. Trump's presidency makes it all the more urgent that we fight for Medicare for All, for the promise of guaranteed health care, as the best alternative to a politics of scarcity and austerity. Looking back over the last 6 or 7 years, many of the biggest gains in terms of building momentum and the effort to convince new legislators to sign on to Medicare for All happened during a Trump administration. And so, even in the midst of so many struggles to stop the repeal of the ACA, to fight back in defense of abortions, to protect people with pre-existing conditions, it was during a Trump presidency that a majority of House Democrats pledged support to Medicare for All, thanks to the power of this movement. So, with that introduction, let me turn things over to Representative Debbie Dingle. I'm just thrilled to welcome Representative Debbie Dingle, who represents Michigan's 6th congressional district and who has been a longtime champion of Medicare for All as the co-author of the Medicare for All Act of 2025 with Representative Jayapal and continuing the legacy of her late husband, Representative John Dingle, and his father, Representative John Dingle. Representative Dingle, thanks for sharing with us your insights and plans for hitting the ground running for Medicare for All in this Congress.
Thanks, Brittany, and thanks to everybody that's on this call. Sorry, gang, I've got the crud. As the saying goes, it's going around. But it's important to be with all of you tonight. And I want to thank you for inviting me to be with you on this call. And I know that Pramila wanted to be here with all of you. All of our thoughts and prayers are with her and her family at this time as she mourns the loss of her father and celebrates his life. And I am very proud to lead this fight alongside my dear friend. So this is something I'm just going to tell you all I'm never going to give up fighting for. And I made a deathbed promise to my husband. I was going to get this over the finish line. So I'm going to get this over the finish line somehow. It's long past time in the United States that we join other industrialized nations in the world in guaranteeing to every American that healthcare is a right, that when you're sick, you should be able to go to the doctor, afford the medicine that you need, and get the care that you should get. I'm leading this because our healthcare system is broken. America spends twice as much per person compared with countries that have systems like Medicare for All, and we still have worse health outcomes, lower life expectancy rates, and high infant mortality rates. We also we know that healthcare systems that are tied coverage to employment will always leave patients vulnerable. We saw this all too well during COVID-19 when we watched millions of Americans lose their job and their healthcare coverage at the same time when we needed everyone to have guaranteed health coverage. And we saw a rise in preventable deaths because people were reluctant to pursue the healthcare they needed. They saw corporations pad their bottom line at a time when thousands of Americans per day were dying of coronavirus. The only people benefiting and the people who don't want us to improve the system are the ones that are profiting. The healthcare system is broken. We have and capitalist venturous firms are taking over more and more, and too many people just simply can't go to the doctor when they're sick. I've been lucky. John was lucky. We've had good healthcare insurance all of our lives. But it used to be when I would take, as many of you know, some of you are young, some of you are seasoned, some of you knew John, some of you didn't. And by the way, his father was one of the authors of Social Security and was the first person who helped draft the first universal healthcare bill in the early 40s. And for those that get frustrated, he introduced that in the early 40s, and it took from then until 1965 to get Medicare. But we got it. We got CHIPS. We got the Affordable Care Act, and we keep fighting. We don't quit. But when I would take him to the doctor in those last few years, it was like going to a town hall meeting. I would tell my staff that you need to give me a couple hours, and people would stop and tell us their stories. Now, the Affordable Care Act has made a difference. Although I've got to behave, I know, but it's public citizens, so I only have to behave. These last 4 days, like, it's worse than anything I thought could be. And there's so much happening and so many executive orders being signed. People don't even know that he's trying to take us backwards, that he's trying to cut money to the Affordable Care Act, that the progress we've made in reducing drug prices, they're trying to take us back. We cannot let the progress that we've made be cut. But people forget the people's insurance, that insurance companies could just refuse to pay for all kinds of things. They'd have surgery that would be canceled if they were in their way into an operating room. That if you had a pre-existing condition, and oh, by the way, that being a woman was a pre-existing condition, we're being denied insurance. We can't go back to those days. And for too many people, that threat is there. We're beginning to see Project 2025 is real. We're seeing the outline of Project 2025 this week. They want to give tax cuts to the billionaires. And how do they want to pay for it? By cutting Medicaid. Medicaid provides health insurance and healthcare coverage to those that need it the most. Those who can't afford it, to the disabled. It's the largest provider of long-term care in this country. We are in a crisis. And Medicare for all is something that we've got to keep up the fight for. We cannot let them get us down. We have to keep up this fight. We have to get people to sponsor it. We have to get people to talk about it. We have to get people to understand that if you are sick in this country, you should be able to get the care that you need. So the progress we made was in no small part to the work that you've done. And when they asked me if I do this, I said, of course, I want to do this. We got to keep this fight going. But I did not know that I would be feeling the way that I do, probably both physically and mentally, when you asked me to do this. I am more worried than I've ever been. I think they're going to try to take the progress we've made and bring it back. And we have got to fight for every single person in this country. They've got a right. When you're sick, you should be able to get the help, the medicine, and the care that you need. And Medicare for all has never been more important.
Thank you so much, as always, Representative Dingle, for joining us, especially when you're not feeling under the weather. We really appreciate all the fight that you've got in you for the years ahead, and we're going to be there fighting with you.
Thank you, Britton. Thank you, everybody. And don't get RSV.
Okay. Yes, I'm trying not to. So next up, I'm going to turn things over to a clip of Representative Jayapal, since she couldn't join us tonight, on when she reintroduced the Medicare for All Act, HR 3421 in 2023. And she outlines the vision behind Medicare for All, but also really points out to this progress that was made and really like bringing so many co-sponsors to the bill, progress that we still have maintained. So let me share my screen. All right. Now comes the challenge where we make sure that the audio works. So interrupt me, folks, if it's not working.
Let me just say that having 112 original co-sponsors in the House is really remarkable. Remember, that is with a House minority just for a couple of years, just until we get back into the majority of Democrats. That is over half of the Democratic caucus here in the House. And I am confident that working with each of you to organize in your districts, we will continue to add to that number by the end of the 118th Congress. Now, what is also important is that we have shown that Medicare for All is supported across the ideological spectrum, from progressive strongholds to vulnerable swing seats, with more counties and cities passing resolutions for single-payer healthcare, including in rural Wisconsin in a district that went to Donald Trump, but still passed a resolution endorsing universal single-payer healthcare. Because the message of Medicare for All is simple. Healthcare is a human right. Everybody in and nobody out. Yeah. It is outrageous that in the richest country in the world, more than 85 million people are uninsured or underinsured. Why? Because our join me in saying shame. Shame. 28 million people don't have healthcare coverage at all. Shame. Even with people who have insurance in 2022, 38% of those people who have health insurance put off medical care because they worried about the cost of that medical care. Shame. Millions are drowning in medical debt. Millions more are one broken bone, one car accident, one new prescription away from medical bankruptcy. Shame. About 68,000 people die every single year because they cannot afford health care. And tying health insurance to your job is cruel and harmful, as we saw during the pandemic when 27 million Americans lost their jobs and lost their health care in the middle of a pandemic. So let me be clear. This must end. We need Medicare for all, and we need it now. Our vision is laid out clearly in our bill. Medicare for All takes our most popular program, Medicare, provides it to everyone, and expands it so that it covers everything that you need to be well. This is about wellness, about preventive care, so you don't wait until you get sick to get the care you need, about mental health care. It includes long-term care. It includes dental, vision, and hearing, reproductive care, gender-affirming care, and all of that without copays, deductibles, private insurance premiums, or other unnecessary fees. No more surprise bills. No more out-of-network providers. No more worries about how to get the care that you need for yourself and for your family. No more battling with private insurance companies who are telling you that they somehow know better than your doctor. No more. 3 years ago, in this House, we had the first ever hearings on Medicare for All, working with leaders like our then chairman of the Rules Committee, Jim McGovern, to hold an absolutely amazing hearing. And that hearing and the ones that followed were so compelling because they were the stories of people across the country who are battling with a broken healthcare, not system, but collection of for-profit centers whose only purpose really is profits for themselves instead of patient care. We are up against big lobbying forces, but I'm here to tell you as an organizer for 20 years before coming to Congress that our movement is way more powerful than they are, and it is growing every single day. So I want to thank all of the incredible advocates who you'll hear from today, all of the people across the country who are here to make sure that people understand that healthcare is a human right and that the time for Medicare for All is now.
Excellent. So let me quickly, before we get to our next speaker, let me just quickly do a Medicare for All 101, just to make sure that we all know what's in the bill. And so, the big thing about Medicare for All is it is a single payer program as opposed to a multi-payer insurance system. And that means that when there's a bill, it's paid by one entity, and that's the federal government. It would expand Medicare as it currently exists into a new single public program with no fees, copays, or deductibles. And it improves Medicare to cover vision, dental, hearing aids, long-term care, reproductive and gender-affirming care, and abortion. It also establishes an Office of Health Equity to be at the center of the administration of this program to make sure that that the program is really targeting health inequities. And so it's not just about guaranteeing insurance, it's also about using this single program in order to improve health inequities. And when you look at how Medicare in Canada works, they do a lot of that. And so it also provides, the basic thing, it just provides health insurance to every person living in the United States as a basic human right, so that healthcare will not be tied to your immigration status, your employment status, or your marital status. And so I will put in later a link to a longer set of explanations of what's in the Medicare for All bills. But for now, it's time to introduce Public Citizen's own co-president, Robert Weissman, to add some more insight. Let's stop sharing. To add some more insight into why our organization has invested in this specific fight. In Public Citizen's 2009 press release announcing his tenure and leading the organization, 2009, Rob wrote that Medicare for All, quote, is the only approach that can cure the system's ills. Rob's expertise lies in government and corporate accountability, and he can speak to the reasons why only Medicare for All is capable of wresting our healthcare system away from the clutches of corporate greed. So take it away, Rob.
Thank you, Brittany. Really appreciate you all joining this. And I also really appreciate your active participation in the chat, which is giving me some sense of who's on the call. I'm going to change what I was going to say in light of who you are. I'm going to spend a little less time talking about Medicare for All and talking a little bit in the sort of the policy piece and a little bit more about, I think, where we are, what we're coming up against, and sort of the strategic approach that we think makes sense, and why organizing around Medicare for All this is an opportune moment to re-engage and reassert ourselves in that effort. I think maybe the first useful thing to do is just to recognize reality, which Brittany's been talking about and Debbie Dingle is talking about. It's like 3 years or 3 days, one or the other, into the second Trump administration. And I see a couple of the comments about people feeling overwhelmed, and it is overwhelming, and it is frightening. And we have a lot to grapple with. And I think part of what we have to do as organizers and activists and committed humans and engaged people is figure out how do we sustain ourselves and how do we maintain hope, and not give into despair and let ourselves get isolated. And for me, I mean, we actually talk about this a lot inside Public Citizen, and people talk about, well, I go hiking, music is my thing, dancing is important, I'm taking up Spanish. Somebody I know is taking up Spanish. But beyond the sort of individual ways of coping, your personal meditation, I think that the most important thing is to be actively engaged and to be in community. And I think we feel worse when we retreat and we feel alone. If we're together and taking action, I think we feel empowered. We can start to make a difference. It's not going to be a lot of great stuff right now, but mitigating harm is a big deal. And I also think when we can, to not just sort of fight the negative fights to stop the bad things from happening, which we're going to have to do over and over and over again, but to find ways to then also talk about the forward vision and to do organizing now to take us where we know we need to be. And I think that's why not just organizing around healthcare, but organizing around Medicare for All is so crucial at this moment, both to get the policy and also to maintain our collective sanity and be able to stay engaged. We are going to face a lot of really hard stuff. You know, the early round of executive orders from Trump and the appointments and so on, we really haven't seen concretely the attacks that are coming on healthcare generally. But they are going to come, and they're going to be across the board and pretty overwhelming. Representative Dingle is talking about the attack on Medicaid. That's going to come from the Elon Musk-led Doge operation. It's going to be part of the reconciliation bill. It's going to be pretty far-reaching. We should be able to stop that. We should be able to stop that, or at least limit that harm. They're going to try to undo and the protections such as they are in the Affordable Care Act and roll it back, making it possible for people to get junk plans and have all kinds of insurance ripoffs. That's a fight that we have to engage and win. Dr. Oz, if he is confirmed to run the Centers for Medicare and Medicaid, is going to promote, along with his buddies, more Medicare privatization. I know you all have been working on this with us. We've all been working collectively on Medicare Advantage, Medicare privatization. We're going to have to deal with that. The gains, modest as they were, but important, we made on drug price negotiation. They've already signaled they're eager to give that away as much as they can get away with. Another fight we're going to have to engage on. Because the things that we support are so popular, if we organize, we have a real opportunity to either stop these things in their tracks or at least massively mitigate the damage, which, as you all know, very real world, not just high-level policy stuff, not just generic dollars, but life and death matters for lots and lots of Americans, as well as just basic quality of life issues. Can you get the care you need, or do you suffer needlessly? Are you encumbered by impossible bills, or are you able to live your life with a decent standard of living because you weren't subjected to some kind of insurance company-enabled ripoff? A lot at stake. A lot at stake. But in addition, it's hard to do it right now, just 3 days in. But I think we're going to have opportunities to do more than that, but to really organize proactively around Medicare for All. And Brittany's laid it out, and the clip from Representative Jayapal underscored how essential winning Medicare for All is. And I'm looking at who's on this call, and I know you guys all know it, so I'm not going to go over it. But I do want to say this. It's a really important insight and recollection that we built congressional sponsorship for Medicare for All during the Trump administration, massively. And that's not an accident. It is an opportune moment to organize more aggressively when there's a Republican in the White House. The Democrats are freed up. They're not worried about contradicting their president. They're able to be a little bit more ambitious. They're more susceptible towards responding to the movement. So the organizing can really drive things forward. Now, I do think our theory of the case has been important, as sort of the one-on-one lobbying is that to really get this further and further and to ultimately win Medicare for All, we have to build a strong grassroots movement. We've been very deeply committed to the idea of doing that through the vehicle of local resolutions, calling for Medicare for All. It gives people a way to enter with real things they can do, with real targets they can see and talk to translate the policy, high-level stuff into everyday language and move policymakers. And then we take those resolutions and leverage them up to members of Congress who think, yeah, actually, there's a real momentum here. It's not just a couple of these crazy committed PNHP people who call me all the time. There's real support. So I think we've got time now to really do that and build over this next 4 years, not just a small majority of the Democrats supporting Medicare for All, but an overwhelming majority. And we've seen this time and again where issues that were a little extreme become mainstreamed. First in the Democratic Party on the way to becoming law. And this is going to be an opportunity, as hard as this period is going to be, to really make gains in the organizing around Medicare for All. So I know you all are, again, I'm looking at who's on this call, and you're people who are in it for the long term. You know this. But I just want to offer the entreaty. Not only is it the right thing to do, it's an opportune moment to be doing it. We can take care of each other by doing this organizing and taking care of ourselves as well. And we can dramatically move the ball forward, even in really hard times, even as we're also fighting these negative fights to stop the bad things that are going to come. We've got a really great opportunity. It's a tough time to join together to have this conversation. I'm so glad so many of you are doing it, even at this moment, and excited for the rest of this conversation. And thank you, Brittany, for pulling everybody together. Let me throw it back to you.
Excellent, excellent. Thanks, Rob. I couldn't have written it better. So, thanks, yeah, thanks really for just bringing it all together for us and why we're in this. And we could have talked for ages about, public citizens' long history. But again, as Rob said, I recognize a lot of the names here, and I know that many of you have been in this fight for a long time, often longer than me. And so I want to give an overview of public citizens' work on Medicare for All so that you can kind of understand what it is we do and how we can help you as activists in your work, no matter what level you're joining us from. Okay, so let me share my screen again. Yeah, that was my cat. I hope you like the cat. That's my favorite Medicare for All meme. Okay. Come on, let's get to the next one. Not that one.
Let me just
There we go. So here's one of the first things we do is we educate legislators on Medicare for All. And by we, I mean Egan. And we haven't had too many questions about Medicare for All in the chat, which is where I normally like to put it because Egan is such an expert. He knows so much. I haven't asked Egan to speak today because he has been working so hard the last 2 weeks. But one of the things he does is just meet with these Hill staffers and just talks with them about the bill. And as some of you will know who have done this sort of one-on-one activism with your legislators, you do need to poke these health LAs in order to get them to actually read the bill so that you can have these discussions with them, right? And so that's one of these things that we do. Another thing that Public Citizen does is, and again, a lot of this is Egan at the moment, is write these reports and fact sheets. Public Citizen, one of Public Citizen's founders of our health research group, really believed in this sort of activist-driven research and this idea of writing these reports that activists can then use in their work. And so we do a lot of that. On the left is this sign-on letter that we have coordinated to get individuals, organizations to, well, this is the report attached to it, to oppose the nomination of Dr. Oz, pointing out the conflicts of interest in the stocks he owns that are connected to Medicare Advantage. And on the right is a report that Egan did, one of my favorites that he did, about the private equity investment in different parts of our healthcare system, and finding sometimes it's really hard to find out if a nursing home is owned by private equity or not. And so these are some of the things that we do in the background that you can find on citizen.org. And also, if you're curious, like, has this research been done about this thing? This is something you can reach out to us about. And because if it's been done, we probably know. Another thing we do is just fighting, speaking of Dr. Oz, just this long-term fight, fighting Medicare privatization and working to strengthen traditional Medicare. The rise of Medicare Advantage is really terrifying. The level of public attention on Medicare Advantage is not like anything we've ever seen. This has been something we've been interested in for years, but now we're at a point where people are really realizing what's going on, how much money is being made. And so just there's a lot of work in terms of reports and information that activists can use to influence legislators. And we work with partners like PNHP to do this work. And yeah, and so the other side of this, of course, is working to strengthen traditional Medicare. Now, when we have had these sort of reconciliation fights with the prior administration at the start, we were pushing really hard for Medicare expansion, and we got really, really close. But this is the thing: is we want to strengthen traditional Medicare as a part of abolishing Medicare Advantage. So moving on to discussing the organizing side of things in the movement building challenges we face. It's like the primary challenge in winning Medicare for all, as many of you know, it's not necessarily industry power. It is and it isn't, right? It's also the absence of the mass social movement that we need in order to win. And Medicare for all is a piece of legislation. Is not, and that piece of legislation means you have to figure out a widespread social movement that is focused on a bill in Congress, right? And so this picture that I included is a picture of a local protest in Chicago about permits related, I believe, to power plants. And that goes to show how in the environmental movement, in the climate movement, you're able to leverage these things. But the target in so many cases is the insurance industry, is just trying to get our legislators on the bill. And so this is this thing that we have this challenge to make, is getting our networks together. So the main thing that we've done for this is passing these Medicare for All resolutions. Now, local government is more accessible to people at the margins of our broken healthcare system than members of Congress. And that's been, in the past, a lot of us have found an easier way to really build these relationships with activists. And I'm not going to read this whole slide because a lot of you are already familiar with it. But what I will say is that we're at an exciting moment where we've passed enough resolutions in quite a few states that we have stronger statewide networks now than we had 6 or 7 years ago when we started this campaign. And that's really, really exciting, right? And so this is what we're trying to do. And so part of this call is we're also thinking outside of resolutions, right? How can we really strengthen these networks? How can we work with these activists who have passed resolutions to do other things because they are? And what we're seeing now is Medicare for All is becoming an umbrella issue that activists who are working on even state bills for state interventions that are not single payer, that this is still the umbrella goal for everyone involved. For example, a lot of our activists have been passing medical debt relief at the municipal level and now at the state level. And that's super exciting. And it's really cool that we're seeing now Medicare for All is this umbrella issue that everyone can get behind at the local level and at the state level. Whereas 6 years ago, it was seen as a separate issue where you didn't see that crossover of activists. And so this is one of the things we want to work on this year, is expanding that trend. So quick resolution tips. I'm just putting this up in a slide, but I've been talking for a bit too long, so I'm going to move on and just share this clip from Councilmember Barnett from my city of Baltimore. He's just talking about why resolutions meant a lot to him as a legislator. And, one of the things we're finding is that legislators have healthcare struggles too. They don't know what to do with their budgets and what they're supposed to cut in order to pay for healthcare expenses. And the injustices of the current system affect city budgets as well. So here's a brief clip from Councilmember Barnett.
Thank you all for allowing me the opportunity to say a few words. I just want to say a huge thanks to the coalition for helping us pass the resolution here in Baltimore City. Back in November of last year, we received unanimous support thanks to all of the hard work of the members of the coalition, meeting with council members, and really just speaking to why this is a huge issue for our constituents. One of for me, it was just important, knowing that there are so many residents, not only in my district, but across the city of Baltimore who struggle with access to healthcare, and, overwhelming medical bills and medical debt and just everything that comes with not being able to receive care and receive care when you need it. We are actually in the midst of our budget hearings right now, and had a hearing earlier today about the impact of the overdose crisis and other sort of just access to care, and how that's really impacting our fire department's ability to respond, because so many people are reliant on just sort of just calling 911 to try and get into an emergency room because they can't get that proactive access to care to their primary care provider on a regular basis. And it just has so many reverberating impacts that you don't really think about on the day-to-day. And so for me, this was just an incredibly important issue to take up, and I'm just so thankful for you all for continuing this fight. I'm thankful for the opportunity to speak to you this evening, and just say some encouraging words from here from Baltimore City that we're proud to be a part of so many cities who've taken this important step, and it's my hope that this is something that will come to fruition very soon for all of us, because it is desperately needed. So thank you all for the opportunity to say hello.
All right, great. So I want to, stop talking and turn things over to an activist that we've been working with an organization that's been doing all these amazing things and working with different local groups and using Medicare for All as this broad organizing strategy. So Scott is with Metro DC DSA. And I'm going to be taking some notes from what Scott has to say. So take it away, Scott. Oh, you're muted.
There it
There we
is.
go.
So, okay. Can you all see the slides in I'm sharing? Okay. So yeah. So hi, my name's Scott. With Northern Virginia DSA, part of the Metro DC chapter. Been organizing for a number of years on Medicare for All, primarily in the resolution campaigns. And one of the things that I've found really kind of difficult with organizing around Medicare for All is just that it feels like a very remote thing. We're organizing around this piece of federal legislation that is sort of an all or nothing, thing. And, it's like we're kind of waiting for all the stars and planets to align, just right to get this thing passed. And so it's very hard to get people motivated to want to organize around it, because I think for a lot of people it just feels like it's a great idea. I like the idea, but it's never going to happen in my lifetime. So I'd rather go organize, do something else with tenants, or work with mutual aid group or something. So I think that's where the importance of local campaigns comes in, and the Medicare for All resolutions is certainly one of those. So in the DC area, we've had quite a few of these passed in the last few years, and DSA has been one of the organizations pushing on this. So DC, Montgomery County, Prince George's County in Maryland, all passed in 2021. In Alexandria, working with Grassroots Alexandria, DSA Nova branch, and our Revolution, Northern Virginia. We got that passed in March of last year. We are currently in progress on a campaign to pass it in Arlington, and we've had some new volunteers come in who are interested in starting campaigns in Loudoun, and Fairfax, Leesburg, and some other places. So we'll be in touch on that. And so I think, just to kind of for folks who haven't worked on these campaigns, I can go over just a little bit of the strategy. Um, so I think with the Alexandria campaign and with the Arlington campaign, we kind of have like an inside outside strategy. I'll say so. You kind of start. You want to find someone on the board or on the city council who is sympathetic, who could be kind of your go to person on the legislation. So they can kind of help you, tell you which commissions you should meet with, and who you need to, what organizations maybe in the county you should try and talk with to to try and build momentum for the legislation. And then you want to usually you'll meet with like the Commission on Aging, or if there's a public health commission, meet with them. Then it's a good idea to then go and speak, do some presentations at the local public hearings, and then when the council members or board members are on the campaign trail in the fall, it's also good to show up when they do a town hall or a campaign event, and kind of remind them, hey, remember me? We talked about doing that Medicare for All resolution. How's that going? So that's kind of the inside strategy. And then I think the outside strategy is even the more important part. So that's where you kind of take your case to the general public. So we did a lot of local media, letters to the editor, writing op-eds. We would go to farmers markets with a clipboard and a group of people and a bunch of flyers, and gather petition signatures, hand out flyers, tabling if you can, if you have the opportunity to table at community events, really helpful. We would do a lot of like social media threads, just trying to educate people on the on Medicare for All, on issues in the healthcare system. And then something that we also found really helpful is to just have like a central link tree where we can gather all the information. Where you can have a link to your petition, you can have a link to the resolution text, have all of your media hits, all of any basic background information on what Medicare for All is. So you have something someone can scan a QR code for, and learn more about your campaign. And then as to why these are important, there's a number of reasons. I think primarily I believe strongly that some of the best, some of the most important work of these local resolutions is the actual public education part, is like doing the campaign. Like getting the win is great and that's awesome, but like actually doing the campaign part of it, and getting stories in local papers about Medicare for All is really important. Going out on the street corner with a clipboard and talking about Medicare for All. Every single person that you talk to, that you get to sign a petition, that's a little victory. And that's one more person who's gotten to think about Medicare for All that day that they might not have. So I think that's really important. Every little win counts. Exactly. Coalition building too. Whatever work we do to build coalition with other organizations. Even different, not necessarily all leftist organizations. Even, they could be with labor groups or with other organizations that are, that are impacted by the healthcare system. You can, another thing that we like to do is when we do petition drives, we have an opt-in option if people want to get it on our mailing list. We can gather a list of several hundred people that we can email with information about Medicare for All. We can about different campaigns that we're working on, and then a nice thing obviously is to get a win. So getting that getting something that you can put out a press release about or something, that's always nice. And I think really the biggest thing is that it's a wonderful way to build community, because you're building solidarity across working class people, and this is Medicare for All. I think more than almost any other issue is it crosses ideological lines, political lines, red state, blue state. It really doesn't matter. So many people wherever they fall on, you know, the political spectrum, have had horror stories about the healthcare system. You know, and if you just talk to people, you know, they can be the, you know, most hardcore Trump voter, but if you just talk to people face to face and say, you know, do you think it's right that a private health insurance company, you know, should be able to deny you care or deny your family members care, or, you know, refuse to pay for cancer treatments, or, you know, because of profit? Do you think that's right? They'll say no, you know, unless they like work for, you know, insurance company, they're going to say no. It's a way to cross connection. And so I think, you know, I think it's also good to look beyond just the Medicare for All resolutions, and that's something that we're trying to do right now in our working group, is explore different areas. One of the ones that Brittany had mentioned is medical debt forgiveness. We're, you know, looking into that. Um, you know, also trying to get involved in other local legislative issues. So whether it's, you know, expanding funding for, you know, local free clinics, or you know, environmental issues, you know, environmental health issues in, like, you know, local sacrifice zones. That's, you know, also really important place that we can organize and tie it in to the fight for Medicare for all. State legislative issues around Medicaid expansion, or you know, around paid sick leave, or, you know, whatever. Those are also great ways to, you know, work towards a, you know, an intermediate goal, and still, you know, keep the overall Medicare for all goal in mind. Doing some mutual aid, you know, whether you're a bulk buyer medicine program, or, you know, helping, you know, your public service, helping people to, you know, with like low English proficiency, to negotiate medical bills. You know, there's all kinds of ways that we can get involved, you know, locally, to build that solidarity. And then, you know, beyond that is just public education. Just keep, you know, whether you're, you know, putting flyers in, you know, little free libraries, or, you know, in, you know, in libraries, or whatever, get, you know, putting up posters around town, putting ads in the local paper, you know, talking about Medicare for all. Like, just keep educating people. Yeah. So yeah, this fight is winnable. It's, you know, it's a marathon, not a sprint, but yeah, I think the local component is so key to building that momentum. Uh, so I'll pass it back to Brittany.
Awesome. Thank you so much, Scott. Maybe I can take it over if I share. Oh, here we go.
There we go. Yeah.
Excellent. Yeah, thank you so much for just like talking about it. I was hoping to learn a lot about all the stuff that Metro DC DSA does. And like, again, you know, we're not waiting for politicians to take the lead on this. Even though they've introduced the legislation, even though we're getting their names on it, we can't rely on them to do the work, right? And that's why we're here. So let me get to the organizing part of things, right? As an organizer. And then we're going to end on time, which is always great. So let me share my screen. So one thing is, you know, I was talking about resolutions earlier, and one of the things we do is we work with activists to write press releases, get really good press releases, and also sometimes maybe the person you were writing, you got to champion your resolution, may want to write an op-ed. So Public Citizen, we have a comms team that can help, you know, edit, you know what I mean? We can help, you know, sort of cook something up that that they can work with to get published. And this is an example, Ras Baraka, the mayor of Newark, New Jersey. Yeah, so like this is the sort of thing that our comms team likes to do. Like one thing we are looking at doing is working more with activists like all of you to put together a rapid response sort of system for writing op-eds and LTEs, like specifically letters to the editor of your local paper in response to trending like news stories, so that you can just have everything you need. Because what I found, at least in my local paper, we have a local activist, Rich Bruning, and he will be in the Baltimore Sun every couple years. He'll just write a quick 1-2 paragraph thing. Oh, this issue says this. Well, you know what would be really good? Medicare for all. And it's like that kind of thing that really, really makes a difference. So we're getting to this interactive portion, right? And we've been like most of the people who are here, people I recognize and recognize each other, right? So it's really time to think about how we're going to be working together over this year, right? Because what one of this big goal that is for our campaign is to do more coordination at state, between activists in their state, but also between the grassroots and the grass tops organization. We want to have a more cohesive movement, right? And we know that like a lot of the best tactics aren't coming from us, it's coming from you guys. So I have this slide up here, which is a Pokemon, which you don't have to recognize too much, but this is a little Pokemon that evolves in 3 stages. And so I'm going to ask you to identify which stage of his evolution, I can't remember what they're all called, I'm sorry, that you identify with the most. And then if you could just put your first name and the city you're in the chat, along with your letter, we're just going to reach out to you after this. And one of the things I want to do is have more of these one-on-one conversations with activists to talk about ways we're going to organize for Medicare for All and make Medicare for All the federal health justice issue that it needs to be, right? So if you're kind of like, all I got time for right now is I can sign an action alert. I can maybe make a couple phone calls, maybe when, if they're asking for testimony on things to a federal department, I can send that. But just keep it by email. So you're level A. That's our little baby Charmander there. So give us your name, where you are, just first name's fine, and say you're A. And if you're a nerd, you can type out what kind of Pokemon he is. So if you feel like, you know what, I'm ready for the next step. I know what Medicare for All is, and I want to get involved in my local community, and you want to have a quick sort of espresso chat with me about ways to get involved, and I can sort of go through this menu of options with you. Tell us who you are and give us your option B. Now, if you're one of these heavyweights, and I've seen you in the chat, and you're already organizing in your community on Medicare for All, or maybe you are on related issues, and you're ready for a venti session, a bigger coffee, bigger conversation, bigger plans, let us know and put in level C. So I'll keep that up while you all put it in. I can't see what you're saying in the chat, but I hope it's exciting. Oh, my mom is a Charmander. That's nice. So excellent. I'm going to keep it going for like another minute. But again, like really thank you all. Like there's a lot of people here tonight that really made this resolutions campaign happen. There's so many people, like I see Walter's here, I see Bill's here. Uh, there's others. I know there's others. I'm gonna feel bad. Was Bruce here? There's someone here in Chico. Betsy's here. Like, Cedar's here. I'm seeing so many of you who are here who have like made all of this happen. And it's like you guys have really made Medicare for All the local issue that it needs to be in order to build this new generation of politicians that's going to win us this policy. So, the chat's going to keep going. I'm going to stay as long as it keeps going. But for now, thank you so much to our speakers. Thanks again to Representative Dingle for coming. I'm going to be sending out the video in the morning, as well as I'll be following up with folks as well. But thanks for everyone for all your work and for making me work hard.